Now X-rays is on. That light turned on red over there, it says X-ray on there, and there's a sign over here that says X-ray on. Usually 7 feet is the minimum distance for. Okay, and now light went off, and it says the operation is finished. You can let go. And then you come and you guide the patient out. Very nice, very good.
Thank you.
Thank you, thank you.
Our beautiful teeth model.
Oh,
Now that's
my
just
God.
that's so far just the
That's cool.
preview image.
Do you like it?
Yeah. Do you like
I see the
it?
smile.
Wisdom tooth.
Look at the wisdom teeth.
Dang.
This is the preview of it. There are some additional features which this machine doesn't have, but you'd always again follow. Do you want to save the captured image? Okay. And then that saves it under the computer, but not in the patient database yet. And so then you say okay, and now the image has been saved under, in this case, in the patient test. Not a bad image.
It does.
Not a bad image.
Really good. Them teeth.
Yeah, and oh, you know, one reason it's a little bit lacking contrast. I had the lowest power setting on it.
Oh, okay.
Yeah,
I didn't have
what it
woman and child. I had the lowest
Yeah.
power setting, and fixing that. But positioning is good. There's no extra shadows. Collarbones are even. If you had your head down just a little bit, you'd have a little bit of more of a smile. And I think the forward-backward positioning wasn't exactly because we didn't have the bite stick on.
Right,
Okay.
right.
But there it is.
It looks good.
That does look good.
Very clear.
So that's panoramic.
Is there any way you can change the settings? Like, since it wasn't on the right setting, can you go ahead and change that back? Or you're just gonna have to do a whole nother panel?
Only thing that can be done with this now is just basic image manipulation, brightness and contrast. By the way, from this toolbar over here, you click your mouse on it and you drag it, and you can change the brightness and contrast from that. If you right mouse click anywhere in the window, it resets it to its default or original location. As far as image enhancements, they're all in here, and I will not go through all of these. They're pretty self-explanatory by the name. From image or from enhancement, there's a lot of different things that can be done and or applied, and SSI enhancement doesn't work very well for Panos. We can have additional training, and if you guys have questions, I'll log in remotely and we'll go through this and we can explain it further. But to answer your question, if the image quality isn't the best or what you desired, besides just a few features that are in the software, a retake would be required. Oh, and I lose my place and I ramble on sometimes too much, but let's try to keep focused here. I'm reminding myself. I'm going to go ahead, start over again, and we'll do the same with the dental CT. Much easier patient positioning. You don't really need to lean. You don't need to set any lasers. The lasers are fixed in the CT mode. You just pop the patient in there and fire away. So again, please select mode, and patient will be still over there in the other room. Now there's a few different features in here, but they're all pretty self-explanatory as well. The FOV stands for a field of view. That is how big of an area you were capturing. This one is 8 centimeters by 5 centimeters, meaning 8 by 5. In 8 that way and 5 up and down. So that is not changeable. But then vertical selection, and you can see when you click on it, the box changes on the guy's face. So that's basically the area that you're going to be taking, and then whether it's center, right, or left. Once you set this up and you know what tooth you want to take, you position the patient, the machine sets itself up to capture the area that the menu indicates. This is up to the doctor whether he wants to, how much he wants to. Voxel is a 3D pixel. Pixel is, you know, like pixels on a flat monitor, but voxel is then the 3D component. That's what they call it. Standard or application. A lot of this goes a little bit more technical. Standard is a higher resolution, which indicates more data, more files, a little bit clearer image, even though none of us would really be able to determine that unless we kind of start looking at it with the microscope, or then standard, or then application mode. It's twice. There's so much more data in the standard mode that it takes approximately 2.5 minutes to process the image, whereas the standard the application mode, a little bit lower voxel size, not as many files, not as much data to manipulate, faster processing time. We're only talking about a few minutes one way or another. I'll leave it up to the doctor or the end user. I prefer always just to use the application because the image quality in my estimation is perfectly good, but especially in the training situation it goes much faster, so we don't have to kind of sit here and if anybody has any further questions or wants any more information exactly what happens between these two selections, I'll be happy to provide that data. Normal and metal, AMAR is metal artifact reduction. So if somebody has a lot of braces or retainers or things like that, obviously you can't take them out. In theory, this is supposed to reduce the scatter radiation from the metal artifacts in the patient's mouth. I say in theory because I haven't noticed a huge difference. But it's there, and there is some. But again, if I take one in normal and one in metal of somebody now, I don't know if we'd be able to tell the difference between us. But then the doctor might go and start manipulating it with the viewing software, which I'll get into briefly real quick. There might be something to it, but just overall my impression. And again, the choices are, and it will usually, if the patient is over 12, it will most likely pick adult every time. And again, weak, it's not like a weak old man, but less bone and or skin density overall. And again, these are both adjustable manually. I'm going to take just an image of this seal tooth that I found in Half Moon Bay a long time ago. And I will we'll do mandible, it's going to be lower, we'll do center, and we'll click confirm. And now the same thing.